All right, welcome back to the Elias Macco Show. Now, of course, over the last few weeks, Quebec has seen strikes across the public sector. It is impacting, of course, health services. And how have these strikes impacted the services being given inside a hospital? There are reports that many seeking cancer treatments have been forced to cancel or reschedule their appointments due to the strikes. In fact, we heard Health Minister Christian Dubé admit that, in fact, and saying those waiting lists are getting longer and longer for every day of the strike. This, of course, creating a backlog for treatment. Let's find out a little bit more. Dr. Laura Masucci joins us, president of the Radiation Oncologists Association of Quebec. Dr. Masucci, welcome to the program.
Good morning. Thank you for having me.
So what is happening on the ground? What is happening with cancer treatments in Quebec right now?
So I can speak more precisely on the state of radiation oncology more than oncology in general. But for sure, in terms of the oncology in general, we see more and more surgeries being postponed, oncology treatments. So I'm talking about chemotherapy or immunotherapy treatments being postponed. But in terms of radiation per se, during the last strike, we saw 20 to 25 patients that had their treatments canceled in the greater Montreal area, and the same amount had the planning of their treatments that were postponed. So, but what's important to know is that these treatments that were postponed for about 7 to 10 days, I would say, for most patients, but are still within what we consider the ministerial targets for the most part. But of course, we can say that any delay can cause anxiety in patients and their families and loved ones, and also for healthcare providers.
How much more can, in your estimation, how much more can the system take? Right, there's this. If the strike continues, right, and you're looking into next year, how much more can the system take before we start to seriously impact treatment plans and people's lives?
Right. What you have to understand also is that the strike has made a difficult situation even worse in the sense that there is a shortage of radiation oncology therapists throughout the province. That already we're able to administer treatments for patients, but it is a very fine balance in all our centers right now, and we are trying to administer these treatments to our patients by treating them in the evening. We're treating them in the on weekends also, but it's a very fine balance, and the strike has, like I said, has made the situation even worse. So for sure, if the strike does continue, we won't be able to sustain this kind of scheduling, and there will be an increase in terms of the treatments that we won't be able to give to patients within that 28-day frame that we usually want to.
We're with Dr. Laura Masucci, president of the Radiation Oncologists Association of Quebec. So if you can't reach those targets, 28 days, what are the ramifications for treatment? Because I would imagine if I was facing a cancer diagnosis, the anxiety and stress begins once you get that diagnosis. What are the ramifications if it goes from 28 to 32 to 40? Take us down that path.
So usually the patients that unfortunately see their treatments delayed are patients that have cancers that medically we consider less aggressive, so that or are under some kind of systemic therapy that maintain the cancer stable, or have radiation that is given after surgery, let's say. So for patients that see their treatment delayed, let's say 7, 10, 14 days, we're not expecting a big impact. But what worries us more and more is the fact that we see these delays being accumulated in terms of surgery being delayed, and then oncology treatments being delayed systemic therapy being delayed, and then we add the radiation oncology treatment being delayed. So all of that for sure accumulates, and possibly, in the end, we could have patients that have more aggressive cancers that need to be treated for sure. or possibly in the worst situation, metastatic. So definitely it's something that worries us and causes anxiety for our patients and for us too.
And on top of it all, we're also going through healthcare reform. Bill 15 just passed, and that will lead to changes in the healthcare system. Can I ask you, while I have you with us, if you have an opinion or an idea of how Bill 15 and that healthcare reform will impact radiation oncology and treatment in this province?
It's going to be difficult to assess, I would say, for now, how it will impact. But for sure, the fact that radiation oncology right now is not considered in the province of Quebec, our services are not considered departments. We are under the authority, if you want, of broader medicine department, makes it difficult for us to take our own decisions in terms of how we can treat our patients and where to better give resources. But in terms of how the Bill 15 will actually impact radiation oncology treatment, it's difficult to know. I guess we'll have to wait and see.
Dr. Masucci, thanks so much for adding your voice to the show this morning. I appreciate it.
Thank you for having me. Have a good day.
You too. That's Dr. Laura Masucci, president of the Radiation Oncologists Association of Quebec. When we return on the Elias Macko Show, we're going to talk about the Cavendish extension. We got some news on that front, and it's not good news. If you wanted to see the Cavendish extension actually happen, yet another delay, yet one more thing that's been pushed back on that front. We're going to speak to the mayor of Town of Mount Royal, Peter Maloof, coming up next. Let me take this moment to remind you about the iHeartRadio app. If you're looking to take CJAD 800 with you all day long, look no further than the iHeartRadio app. It's at your fingertips, available on iPhones and Android phones, and you can keep CJAD 800 with you all day long.